I'm Erin Ryder, news editor of The Horse, Your Guide to Equine Healthcare. We're here at Rood & Riddle Equine Hospital in Lexington, Kentucky with equine podiatrist Dr. Scott Morrison. Dr. Morrison's going to tell us a little bit more about the stinky problem of thrush. Dr. Morrison, thank you very much for joining us today. Would you tell us what thrush is?
Yeah, thrush is basically it's a bacterial and fungal infection of the frog and the sulci of the frog. It's not one particular bacteria. It's mostly just a bunch of different microorganisms that can cause thrush.
And what causes this problem?
Usually it's horses that are, it's usually excessive dirt and debris that accumulate around the frog, and that traps in moisture and dirt and makes a perfect environment for a bacterial infection in the frog.
What can horse owners do to prevent this?
Pretty simple, really. I mean, just basic daily cleaning of the frog is usually that's all it's required, and then having a fairly clean, stable, and stall environment.
And would you show us some of the clinical signs that someone might look for?
Yeah. Basically, thrush is just basically a superficial bacterial infection of the frog and the sulci. So it's usually either the central sulcus of the frog gets infected. It's usually mushy and soft. Oftentimes, when the central sulcus gets really badly infected, it can get pretty close to sensitive tissue. So they can be sometimes a little bit tender and painful when you palpate or press on the central sulcus. But a normal central sulcus should have like a teaspoon kind of shape to it, nice shallow depression. And when they get a thrush infection of the central sulcus, oftentimes they get a real deep crevice or deep crack that goes between the heel bulbs. It can be pretty painful, and sometimes it'll travel up to the hairline as well. So that would be a thrush of the central sulcus, but you can also get thrush along the medial and lateral sulci of the frog as well, and these little commissures here as well. And again, the first sign would just be a deep crevice, and there'd be some black pasty debris in there. And you'll notice that these sulci getting deeper and deeper with time because the bacteria can damage the sole and frog tissue. They can digest the epithelial tissue and make it deeper and deeper. So the first thing you'll see is just a deeper and deeper crevice with some black exudate in there. And then in the more advanced cases, you'll see some painful and sensation and maybe some lameness.
Would you tell us a little bit about treatment options?
Yeah, treatment usually is just good foot care. Like the farrier, typically when they trim the foot, they'll oftentimes take their hoof knife and just clean out these sulci of the frogs and the central sulcus as well. You want to clean it out and have it nice and shallow so it doesn't trap dirt and debris in there. And then just daily picking out of the foot, just a hoof pick. And it's also a good idea to have a little wire brush for horses with thrush, or just preventatively when you clean the foot, you can get there's little tiny wire brushes, look like little toothbrushes, and you can clean out these sulci really well. So just basic cleaning and having a nice clean stall, and you're not keeping the horses in overly muddy, soft conditions for prolonged periods of time. It's also helpful. So that's how you prevent it. And for treating it, it's you do the same thing. You keep the foot nice and clean, and then almost any kind of antiseptic will kill thrush. It's not a very hard organism to kill. Just a betadine, any of the antiseptics will pretty much kill the bacteria.
If you have a thrushy horse, at what point do you need to get a veterinarian or a farrier involved?
I'd say if there's signs of lameness. If the horse is showing lameness or sensitivity to palpation of that area, I'd probably have a veterinarian look at it. Because thrush, we typically just think of it being a superficial infection, but it can advance and it can get into deeper tissues. And I've had cases that come into us with severe cases of thrush where it's actually eaten all the way through the frog into the digital cushion. This is the digital cushion here. The digital cushion right by the heel bulbs, and it can erode all the way through the digital cushion. And I've had some either where the deep digital flexor tendon was exposed, so it can get pretty advanced, and it can start damaging some healthy, very important structure of the horse's foot.
Thank you very much, Dr. Morrison.
No problem.